Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Living with cancer. Introduction. Cancer is common. Half of all men and a third of women will get a diagnosis of cancer in their lifetime. Many people with cancer survive the disease. For most people with cancer, living with the disease is the biggest challenge they have ever faced. Learning more about ways you can help yourself may ease some of your concerns. Support from others is important. This program explains living with cancer. It discusses how best to take care of yourself while you cope with the disease and its treatment. Cancer and its treatment. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing. These extra cells cause an abnormal growth. This growth is called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. It is also called a non-cancerous growth. Benign tumors are often not life-threatening. A malignant tumor invades nearby tissues and body parts. It is also called cancer. Cancer cells are able to spread to different parts of the body. They can spread through blood vessels and lymph channels. Lymph is a clear fluid that is made by the body and drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For example, a lung tumor may grow through the lung's outer layer. It can then grow into nearby tissues over time. Cancers in the body are given names. These names depend on where the cancer started. Cancer that begins in the breast will always be called breast cancer, even if it spreads to other places. The type of treatment used depends on the type of cancer you have. It also depends on the size and location of the tumor, the stage of the disease, your overall health. Treatment for cancer may include surgery, radiation therapy, chemotherapy. A combination of these treatments may be used. Surgery for cancer depends on where the cancer is located. In most cases, the surgeon removes the tumor and some tissue around it. Removing nearby tissue may help prevent the tumor from coming back. The surgeon may also remove some nearby lymph nodes. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. The way the radiation therapy is given depends on the type and stage of the cancer being treated. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It can also be placed in a specific area of the body. The type used depends on the type and stage of the cancer being treated. Radiation therapy and chemotherapy may sometimes be done together. These treatments may be used on their own before surgery or after surgery. Sometimes cancer treatments may also involve biological therapy, hormone therapy, stem cell transplant. Talk to your healthcare provider to learn more about your treatment options if you have cancer. There may also be clinical trials available for people with cancer. Clinical trials test new medical approaches and treatments. Managing side effects. Cancer and its treatment can lead to other health problems. It is important to have supportive and palliative care before, during, and after cancer treatment. Supportive care is treatment to control symptoms, relieve the side effects of therapy, and help you cope with emotions. Palliative care is care given to relieve symptoms without curing a disease. It is a central part of treatment for serious or life-threatening illnesses. If you have cancer, starting palliative care early in the treatment can boost your quality of life and lift your mood. Hospice care, which is care at the end of life, always includes palliative care. But you may receive palliative care at any stage of a disease. The goal is to make you comfortable and improve your quality of life. Palliative care is focused on providing patients with relief from the symptoms, pain, and stress. It can be provided in the hospital, outpatient clinic, at home, through hospice, and in other settings. Talk to your healthcare provider for more information. Common side effects of cancer and its treatments include anemia and bleeding problems, constipation or diarrhea, fatigue or tiredness, nausea and vomiting. Other common side effects may include confusion and memory problems, fever and infection, pain, skin changes. Go to all of your treatment sessions and follow-up appointments. Use the time with your healthcare provider to ask questions about any concerns you may have. Knowing more may help you feel more in control. Your healthcare provider may prescribe medications to help you deal with the symptoms of your cancer treatment. Cancer and its treatment may affect your sex drive or response. It may also affect your fertility. Talk to your healthcare provider before treatment about your options. You should also talk to your partner about how you are feeling. Cancer during pregnancy is uncommon. Some treatments for cancer can harm an unborn baby. To prevent pregnancy while undergoing treatment, talk to your healthcare provider about birth control options. Hair loss may happen as a result of cancer treatment. It may grow back 3 to 6 months after treatment is over. If your hair falls out, cover your head to protect it from the sun with a hat or scarf. Consider using a wig that matches your hair type and color, or choose a new look. Use lotions to moisturize skin. Talk with your healthcare provider about your options. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Nutrition and exercise. Loss of appetite is a common side effect for people undergoing cancer treatment. A patient's taste for food may change. Nausea can happen. But even as eating becomes harder for some patients with cancer, good nutrition remains critical to help maintain body weight and strength during treatment. Having good nutrition means eating the right types of foods in the right amounts. It is especially important for someone who has cancer to eat a nutritious diet. This can support the body's immune system and overall health. Treatment for specific cancers may be supported by specific diets. Talk to your healthcare provider about the meal plan that is best for you and your cancer care plan. Enjoy making healthy food choices by keeping your kitchen stocked with your favorite healthy choices, planting a vegetable or herb garden for ingredients, taking a cooking class, using a new cookbook with healthy meal plans. Regular physical activity can also help you feel better during and after cancer treatment. Exercise has lots of benefits. It increases your physical strength and endurance. Staying active can also help you sleep better. Getting enough sleep during and after your cancer care can help you stay energized and feel refreshed. If you are living with cancer, it is important to discuss an exercise routine with your healthcare provider before you begin. Together, you can develop an exercise routine that is appropriate for you. Cancer and your emotions. Cancer and its treatment can change your routines, roles, and relationships. It can also change the way you feel and look. Feeling anger, shock, fear, or sadness after a cancer diagnosis is normal. Do not avoid your emotions. It's better to recognize and express them than to keep them inside. Explain to your family and loved ones how you are feeling. They may have some ideas for you on how you can best manage your emotions. As a cancer patient, your personality traits affect how you deal with your diagnosis and interact with your care team. Not everyone will have the same preferences for communication, interaction, and stress relief. Some people may find that asking lots of questions of their health and sharing news about their treatment with others can help control emotions. You may need support and energy from others to help you through this time. Other people may be more reflective about their diagnosis and treatment. You may prefer to research and reflect on your diagnosis first before sharing the news with everyone. When you do share the news, it may be with just a few close family members and friends. Depending on your preferences, other coping strategies include awareness events such as walks or runs where you can actively give and receive support from others. Expressing your emotions creatively through art projects. Interactions with in-person support groups. Journaling or blogging about your feelings. Meditating or practicing yoga. Keep busy. Get out of the house and find activities that will take your mind off your fears. Fear of recurrence is common in people in remission and in cancer survivors. Though they may go years without any sign of disease, the thought of recurrence is always with them. Cope with your fear by being honest with yourself about your feelings. Try not to feel guilty about your feelings or ignore them in hopes that they will go away. Take control of those fears and do what you can to influence your future health. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. For most people with cancer, living with the disease is the biggest challenge they have ever faced. Learning more about ways you can help yourself may ease some of your concerns. There are many factors that determine the type of treatment used for cancer. Cancer and its treatment can lead to other health problems. It is important to have supportive and palliative care before, during, and after cancer treatment. Having good nutrition means eating the right types of foods in the right amounts. It is especially important for someone who has cancer to eat a nutritious diet. This can support the body's immune system and overall health. Regular physical activity can also help you feel better during and after cancer treatment. Exercise has lots of benefits. It increases your physical strength and endurance. Some people may find that asking lots of questions of their health and sharing news about their treatment with others can help control emotions. You may need support and energy from others to help you through this time. Other people may be more reflective about their diagnosis and treatment. You may prefer to research and reflect on your diagnosis first before sharing the news with everyone. When you do share the news, it may be with just a few close family members and friends. Cancer and its treatment can change your routines, roles, and relationships. It can also change the way you feel and look. Feeling anger, shock, fear, or sadness after a cancer diagnosis is normal. Do not avoid your emotions. It's better to recognize and express them than to keep them inside. Thank you for using Explain.